Well, I have a very interesting show for you today, and it's with Jamison Spencer, who is a dentist. And I asked for a bio so I could give you a little idea of him, and I got the sweetest note from his wife, and I'm just going to read it to you because I just thought it was perfect. It says, "Hi, I'm Jenny Spencer, and I'm the wife of the most amazing TMJ and sleep apnea guy in the world, or at least I think so. We've been married for 24 years, and over that time, I've watched him enthusiastically throw himself into everything he does. Years and years of university degrees, extra training, conferences, and additional master's degree leadership positions in various academies and societies, and lonely weekends have yielded two wonderful passions for Jameson. He loves getting people out of pain, and he loves treating sleep apnea patients, which of course is what we're going to talk about today. In fact, he's treated more than 5,000 sleep apnea patients in his 15 years of working with them, and he's gotten more couples back in the same bedroom than many relationship therapists. Together, we travel the world teaching other dentists and doctors how to treat people that suffer from these problems." So there you have it, an endorsement from his wife. So, Jameson, we know you're a dentist, we know you're a great husband, and you help people with sleep apnea. But what on earth does sleep apnea have to do with dentistry?
Oh, that's a great question, Gail. So, for people who don't know, sleep apnea is when you stop breathing when you sleep. This is usually associated with someone who snores, and then they may have little pauses in their sleep or in their snoring, and that is typically an apneic event. And the typical treatment for this involves a mask and a machine. That's called CPAP, or continuous positive airway pressure, and many people call it the mask or CPAP, whatever. And it's a great treatment. CPAP works for everyone who can stand it. And unfortunately, about half the people that are put on CPAP give up within about a year. What we as dentists do is we make custom-made mouth guards, basically, custom-made guards that keep the lower jaw, the mandible, from falling back and obstructing the airway. These appliances are not 100% effective like CPAP is, but they tend to be very easy for people to tolerate. So while the efficacy may not be quite as high as CPAP, the ability to tolerate it is much higher than CPAP. So for some people, it's the perfect therapy for them. Again, especially those who have tried CPAP and have given up on that. There are way too many people out there with a CPAP machine in their closet, and that does not do them much good.
Well, that's true. I know that my husband had sleep apnea and was given a CPAP, and he used it. Then he didn't use it, but then in the end he did use it because it really made a difference for him. But I'm not sure that the guard that you're talking about was ever even suggested to him. Is that a new idea?
Well, it's not that new, but that's not surprising at all to have you say that. So the vast majority of patients that I've seen over the past 15 years or so have said the same thing. Like, why did no one ever talk to me about this? Why wasn't it even offered? So oral appliances have been used to treat sleep apnea for well over 30 years. They have been standard care for the past decade. Covered by medical insurance, covered by Medicare, covered by everybody, TRICARE, military insurance, you name it. However, because CPAP was kind of there first, and because it's given by durable medical equipment providers that have connections with the physicians and have for decades, the dentists and the physicians working together, that's a little new. So oftentimes patients are not really brought up to speed on all of these different options. And unfortunately, in some cases too, it's a matter of money. Oftentimes dentists, it's a real struggle, frankly, for dentists to go through the process to work with medical insurance. Frankly, because there's dental insurance, and dental insurance usually works with dentists, and medical insurance works with medical doctors. And that's one of the biggest problems. So sometimes doctors will mention to a patient, especially a patient who gives up on CPAP, well, why don't you talk to your dentist? Or maybe you could go to a dentist and get one of these oral appliances. But then in the same breath, they'll say something to the effect of, hey, heads up, this may not be covered by insurance very well, and they're really expensive. Well, because of that, a lot of people won't even seek out to find out how much it costs. In my practice now in North Carolina, where I currently live, I'm the director of a large group, and I help out with sleep apnea in this large dental group. And the vast majority of our patients in North Carolina pay only $50 for a custom-made appliance, and their insurance picks up all the rest. So for those people, it's a no-brainer. I mean, why wouldn't they try?
Absolutely. Well, you talk about deep sleep as being very important. Does the percentage of time spent in deep sleep change as we get older?
It does. So as we get older, unfortunately, our deep sleep goes down and down. They say that even by age 40, it can reduce to little or nothing. And I think all of us over 40 recognize that because we remember back in our teens and 20s, we could sleep anywhere. We could sleep on any bed, any pillow. We could go to a hotel. Didn't matter what the environment was, and we slept fine. But as we get older, I know lots of people that travel with their own pillow. And my wife will do that, and I'll say, honey.
I see that on planes all the time, and I always say, why are they doing that?
Exactly. Say, every hotel we've been to, dear, has pillows. As far as I've seen, I don't need to carry your own. But she sleeps better with her own pillow, and this is very common. And so as we get older, it becomes harder to get that deep sleep, but becomes more and more important. I truly believe that deep sleep is the fountain of youth. And if people can do the things necessary to increase their percentage of deep sleep, it will have a dramatic improvement on their health.
Well, I must be very lucky because I hit the pillow and I am out, and I pretty much sleep through the night. It's really amazing. My husband used to say to me, "You say to me, I'm going to sleep. You turn over and you're gone." So I don't know if it's because I'm so busy all day. I don't know, but it certainly is easy for me to be able to get a deep sleep. But do children ever have sleep apnea?
They do. So children, and this is kind of my theme now, my passion is helping people who are getting missed. And our medical colleagues are looking for fat old men. That's really all they're looking for sleep apnea. So if a thinner woman, if a younger woman goes in, if a thinner guy goes in, or a child. If a child goes in and starts talking about various symptoms, all of those people I just characterized there are way more likely to leave the office with drugs, with medications. In the case of children, the symptomatology they'll have will be very similar to symptoms of ADHD. But everyone who has children knows that if you keep a young child up way past their bedtime, they get cranky, irritable, hyper. So a lot of times I believe that these kids, it's being missed. And for children, it can be very subtle. It's not the big snoring. However, if a child does snore and or grinds their teeth, it's very likely that they have sleep apnea. I teach dentists again around the world, and that's one of the things I tell them to look for. If the kid has evidence of tooth grinding and they snore, they've got sleep apnea.
Is it possible to snore and not have sleep apnea?
It is, and for years they used a term called benign snoring, but that term is starting to go away too because they've found that even people who just snore, no sleep apnea, they will have a tendency to have increased atherosclerotic plaques or arteriosclerotic plaques in their carotid arteries. The theory behind that is that vibration right there in your throat is right by your carotid arteries. That's where you take your pulse, right there on your neck. And that is causing turbulence of the blood flow and causing people to have plaques there, which then significantly increases their risk of stroke. So just snoring alone by itself has been shown to have an increased risk of stroke and other fatal problems just with snoring.
Wow. Now you mentioned they don't pay attention to, slim women or slim men. Does sleep apnea have any relationship to weight gain or difficulty in losing weight?
It does. That's something that also gets missed all the time is when you have sleep apnea, there's two main hormones involved with our appetite and so feeling full and feeling hungry. It's called ghrelin and leptin. And those two hormones in sleep apnea get screwed up. And so we become where we feel always hungry and never full. And that's one of the sad things to me is most people don't understand this. And so they try to go on a diet and they may suck it up for a week or two on self-discipline. But if they have sleep apnea, it would basically be like their brain saying 24/7, you're hungry, you're hungry, you're hungry. And every time they eat saying, you're not full, you're not full, you're not full. And that makes it really tough for those folks to lose weight when they're going against this hormonal drive. I have many, many patients over the years where all we did was treat them for their sleep apnea, made no comments about their diet and exercise regimen, and within a few months, they had lost significant weight trying nothing. They didn't change anything.
Wow, that's quite a statement. I can't even believe that. I mean, that's amazing. Now, you say that that of course getting a good night's sleep is very important. But what happens during sleep that makes it so critical?
Well, what's interesting about that is scientists really don't know completely why we even sleep, except for the fact that we have to. So all mammals must sleep. So even dolphins sleep. They shut down half of their brain and they swim in a circle, a clockwise circle, and then later they shut down the other half and they swim in a counterclockwise circle. It's really interesting. So all mammals must sleep, and we know all sorts of great things that happen during sleep, such as growth hormone is released, our muscles and tissues heal themselves. That happens during deep sleep. So someone who doesn't get adequate deep sleep will tend to always be sore, and their muscles will be sore, and they will probably eventually get diagnosed with fibromyalgia or TMJ or TMJ problems. In REM sleep, that's rapid eye movement sleep, that's where our brain, I like to say, defragments its hard drive. That's where the brain gets rid of all the stuff it doesn't need and holds on to the things that it thinks will be important down the road. If we don't get REM sleep, we kind of go a little crazy. We can't remember things. We can't think straight. We get mentally fatigued. And those are just a couple of the things. There are many, many things that go on during sleep that they're even still learning. It's amazing to me. I have a sleep apnea and sleep as a Google alert on my phone, and every single day I will get 3 or more news stories about sleep apnea, and the connections to our health.
Well, now, what do you have any knowledge in terms of people say, well, I don't need that much sleep. There are people who can get by on 4 or 5 hours. Some people say 6 or 7. Other people say if you don't get 8 or 9, you're not getting what you should. Is there some kind of formula, or is it really individually?
That's a great question, and it is really individual. When you see things like 7.5, 8 hours, you got to keep in mind that those are typically averages of studies that have been done over the years. So what I always recommend to people, and frankly, this is easier said than done, but if they will go to sleep at the same time every night for about a week and then wake up without an alarm. So kind of a nice way to do that is they would start off on, say, Saturday when they aren't going to work maybe the next morning. They go to bed at 10 o'clock and they're going to sleep, and they may sleep longer than normal, but it's Saturday. They do it again on Sunday, go to bed exactly the same time, and then wake up probably before their alarm normally would have went off. If they do that, after about 4 or 5 days, they're going to know this is how much sleep I need. And a lot of people get very, very good at that. They know exactly how much they need. Some people do need a little more, 8.5, 9 hours. Teenagers need way more sleep. And most people think that teenagers are lazy, but it's actually that they're still children, and they may need 10 or even 11 hours of sleep to be fully functioning at their top level. And that makes it really tough when they're teens, so they want to stay up late, and then they got to get up to go to school at 6 a.m.
Many of them do get up so early to go to school. That's what I've noticed is that they have so much homework. They're doing that late at night, and then they have to be up early to catch the school bus or whatever.
That's right.
And they're
right.
not getting enough sleep. That is amazing.
It's a major problem.
I mean, I can see. It's funny, we're talking about alarm clocks. I always get up without an alarm clock, and I always get up pretty much the same time. I do go to bed the same time every night, although I found that this last few weeks, with nothing being on television because everything is a repeat, I've been going to bed an hour earlier, but I'm still getting up